Welcome to your interview prep for your domiciliary care agency business. This is Gradle speaking, and I'm going to go through some of the key things that you will need to know before you have your interview. So we're going to look at the Health and Social Care Legislation 2008, 5 key questions and the fundamental standards. In the sections that I'm going to cover, you need to be really clear that inspectors will be wanting to know from your perspective as the registered manager and also as the registered individual how you're going to keep your service users safe, secure, and also to support your staff and also provide effective leadership. So the 5 key questions they ask for this is it safe? Is it effective? Is it caring? Is it responsive? Is it well led? Is it safe? Inspectors will want to assure themselves that people are safeguarded and protected from harm and abuse. They look at how you protect people from risks, safely recruit and train staff, manage medications, and implement infection prevention and control measures. They will also want to know how you learn when things go wrong in order to minimise these reoccurring. Providing evidence of how you have responded to incidents is really important. When looking at is it effective, inspectors will want to know if your service is meeting people's needs or, more importantly, the outcomes that people have identified. They're likely to look at how the service complies with legislation and evidence-based good practice, how people are supported to be healthy, and how services seek consent. The CQC will look at how your service engages and works effectively with other providers. When looking at is it caring, inspectors will want to satisfy themselves that the service is a compassionate one and that people are respected and lead dignified lives. People must be treated as individuals and their independence valued with strong attention to their strengths, abilities and aspirations, culture and unique backgrounds. This will be supported by evidence of a personalised approach that records time spent with people. When looking at is it responsive to people's needs, inspectors will want to know that people's needs are at the centre of care planning and treatment choice. Provision is planned and delivered to ensure integration, flexibility, choice and continuity. So responsiveness will look at how people are supported to achieve personal goals and how people are involved in deciding their day-to-day care. Care planning extends to the future and includes your end-of-life care provision. And finally, is it well led? Inspectors will look at the culture at your service and how you involve the people you support in setting the strategic direction of the care that's delivered. They'll review your approach to equality and human rights, diversity and inclusion. The CQC will look at how you're saying that your service is going to be governed. So if there's a board of directors or trustees or an individual owner, then their expertise, actions and influence will also be looked at. They will also want to speak to the nominated individual for the service. It's important that your service can evidence you have capable and compassionate leaders, well connected within the local community through effective partnerships. You will also need to evidence your approach to quality assurance and driving forward improvement to strengthen the service. Inspectors matter. They provide you with valuable feedback, but fundamentally your service needs to be guided by commitment to quality and safety and be built around each individual that you support. You need to have confidence in what you're saying and what you will be doing, and you need to think about how you will satisfy the inspectors in your response during the interview. please don't forget to like, subscribe and click the bell to get notifications of when we do more videos and upload them.